Melanie, are you having a hard time with your sound? Melanie? Amber, are you able to pick up? I don't know what's happening with Melanie. I see her mic is on, but nothing's happening.
And while Melanie is coming, I would like to give special thanks to you, Carrie, to Dr. Jinnah, and to Dr. Moore, that are the three of you giving us the honor and pleasure of being with us today. Thank you very, very much.
Thank you, Monica. It's very kind.
Pleasure.
So, all right. Amber, I still don't see, I can't hear Melanie. I hate to put you on the spot, but
That's okay. I just I'm trying to message her in the background as well.
must be something.
That's okay. I can start, and if she pops in, I'll let her take over.
Perfect.
So thank you again, everyone, for being with us today. It really means a lot to us that you're taking your time out of your day to listen to us speak. We've had the pleasure of meeting with, being with Near North Palliative now for about 8 to 9 weeks. We've been working closely with them, and we collaborated to decide on their expanding their volunteer network, or attempting to expand their volunteer network. And this Lunch and Learn is to focus on that today. So we've put together this Lunch and Learn with a bunch of experts in the field, as well as volunteer coordinators and a few volunteers themselves, to speak to palliative care. So we're going to start. We've actually have a recorded video from Vic Fideli. He's going to speak to us about the importance of community and the importance of palliative care, and what you can do to help the community that you're in, which is focused on North Bay and surrounding area.
Don't think anyone can hear that, and I can attest to the fact that they have gone through this video about 400 times.
Sorry, I believe I forgot to share my audio again. Sorry about that. Try that.
Hi, everybody. Vic Fideli here, Nipissing MPP. Thank you, Allison, and the incredible team at Nipissing University for hosting today's Lunch and Learn. This event is a great opportunity to shine a light on palliative care training, and the excellent work being done by Near North Palliative Care Network. Palliative care ensures that people have a choice about where they spend their final days, and that their loved ones are supported during this very challenging time. For more than 35 years, Near North Palliative Care Network has provided members of our community with high-quality, compassionate, end-of-life services. We truly cannot thank them enough. This incredible group of dedicated volunteers exemplifies the best of what Premier Ford likes to call the Ontario spirit, the spirit of compassion and dedication to local communities. So thank you to the nursing students and everyone who has volunteered or who is considering volunteering. We are so proud of you, and we know that you are going to achieve great things. Now, best wishes for a successful event.
So thank you, Vic, for sharing that with us. We really appreciate that. Now, I also have the honor to introduce Monica. She has been a shining light in this topic for us. It's so nice to talk to you every week. Your passion for this topic is outstanding. I am very happy to have met you, even though it's virtually. To meet you in person would be an honor. So I'll hand over the mic to you to talk about volunteering with your amazing volunteer network.
Thank you, everyone. It's a joy and an honor to have you all with us today. I would like to start sharing my personal story, how I became a volunteer at Near-North Palliative Care in 2009. I had come to, I moved to Canada in 2003, and that's all immigrants. I was already mature. I had 49 years old when I moved to Canada, and all of us feel that need of belonging and finding the new group to be together and to contribute to your new country. So I was kind of shopping around everywhere where I could find a group that would be very meaningful for the second part of my life. And then I started training for the palliative care training, as all the volunteers are now doing. And at those times, the training were 8 Thursdays from 6 to 9. And if we missed one of the sessions of training, we would have to wait for the next year to complete the training. So that's when I entered in touch with our admirable volunteers. They were mostly stay-at-home baby boomer housewives or retired nurses and social workers. And when I started helping them with the clients, I said, wow, they are giving their time, paying guests, and even bringing cookies to their clients that are dying for free. These are the best people ever. I want to belong to this group. And so I started volunteering for palliative, then for bereavement, and the rest is history. This year is year 10 that I am doing something official to Near-North. I started as volunteer, then was board member, then I was bereavement volunteer and trainer, then volunteer coordinator for palliative care, and finally executive director. And if you ask me why I am still passionate about volunteer for Near-North Palliative Care Network, what I can share with you is just come and taste the experience. It is a rare honor to be at the bedside of a dying person or be the witness of a broken-hearted caregiver that have just lost their loved one. At this point, the person has no more social masks. All the social masks are totally gone, especially if you are at your deathbed. There is no more need, you are no more fear of losing anything by just being you. It's a privilege and an honor to listen to the soul, to the self of that person, that human being, one after the other, after the other. It's the most genuine interaction that we can establish with people around us. This soul that reveals itself naked to you, all their truth, all their fears, all their loves, all their regrets, all their guilt, establishes with the volunteer one of the most meaningful relationships we can ever have in life. Just count the number of soul-to-soul, completely naked like this, interactions that you have a year in your normal lives at work, with family, etc., with your friends. In most situations, we always have a social mask. And this is what does not happen when you interact with palliative care or bereaved clients. It will be a soul-to-soul interaction at every time. If you have 4 clients that day, you will have the honor of having absolutely true, genuine, soul-to-soul interactions with people. And that's my story, and I hope you join us.
Thank you, Monica. Next, we will hear from Dr. Hailey Moore. She was one of the newest members of the palliative care team in the Nipissing district. We are so pleased that she's here to talk to us today. Welcome.
Hi, Melanie. Thanks for the introduction. Can you hear me okay? Yeah, great. Okay. And thanks for those beautiful words, Monica. I agree. It always sparks a little bit of a fire to hear you speak with such passion about what you do. So yes, I am relatively new as a palliative care physician here. I have just kind of started my practice just over a year and a half ago, and it's already been really inspiring to see what has been done in this community. So I've been asked to speak a little bit more about palliative care in the community, why that's important and what that looks like. So palliative care, as I'm sure you know, is it's addressed at the whole person, the whole family, at aspects of care that are physical and symptom management, but also social and interpersonal and spiritual. And so it really takes a village and a whole team to help address these things for somebody. Palliative care is can be for anybody with a life-limiting illness or a serious illness, and it aims at helping with quality of life for that person. And so when I think of kind of my own place in this, so I do kind of specialized palliative care or consultant palliative care for people both in their homes, in the hospice, and at the hospital. And something that kind of a mentor to me said one time is to remember the 99% rule, which is that the patient spends 99% of their time not with me. And just to remember that, you know, they spend 99% of the time with their people, with their community, with their families, with their church groups, with their friends. And so to think about bringing palliative care back to the community and to add in this robust palliative care volunteer network as well, I think is just so important. And really, when we think about death and dying as a society, sometimes I think it's been kind of removed from the community or removed from people and medicalized, right? And so I think community palliative care and having resources in the community for palliative care can help bring death and dying back to being not just a medical experience, but a human experience. Palliative care is not just for people who are at the very end of their lives, although that's a very important point in time, in a time that someone often needs a lot of help and resources. It's also about living with serious illness along the way. And so it's not just about death, but about living. And again, often that takes a village and takes a whole team. When you ask people what their hopes are and what their goals are and what their values are, like everyone is a little bit different, right? But it's very commonly that people will say they don't want to be in a hospital, right? They want to be at home. Sometimes just based on care needs, that's required, and we make that work as best as possible. But generally, people want to spend as much time as they can in their homes, and possibly even if they can spend the end of their lives and their deaths in their homes. And so I was asked to speak a little bit about what palliative care looks like at home, at hospital, at hospice. When we think about someone's home, we also have to remember that home looks a little bit differently for everybody. Home can be a house or an apartment, but home can also be long-term care. A group home is a person's home. We also think of the people who are unstably or vulnerably housed, and so they may identify a place as being a home that what we wouldn't have necessarily thought of. And so there's some therapeutic power and there's some importance of being home, right? And so again, we know that people say they want to pass away in their own homes, say they want to die at home. The most recent statistics in Ontario that we have, which are kind of just pre-pandemic, say that despite many people wanting to stay in their homes, only about half of people are able to have their end of life in their homes. And that does include long-term, I'm including long-term care in that 50% as well. We don't have updates through COVID, and I'm not sure whether it's been better or worse, honestly. People, I think, during COVID are even more motivated, perhaps, to stay home and stay out of the hospital. But also healthcare resources have become more strained and slim in that time as well. I was asked to speak a little bit about palliative care in the community, in the hospice, and at home. So in some people, because of their care needs or the acuity of how quickly things are changing, or just the resources that they require, do have their end of life care in the hospital. That doesn't mean that they have to have their end of life care in an extremely medicalized setting, though. There are, for example, several palliative care suites at the hospital, which are meant to be kind of, larger and more accommodating to family, with a little bit of a nicer view and a little bit more of a calm and peaceful environment. And regardless of where a patient is in the hospital, we have people, trained with a little bit of expertise in palliative care to help make their end of life care, supported both for the patient and for the family. Some patients who may wish to have their end of life care in a home-like setting, but that's not feasible for some reason, may also choose to have their end of life care in the hospice. So we have a hospice in North Bay. It opened basically just before the pandemic hit, and it's a beautiful place. There are 10 rooms and 10 beds there for patients who can spend the end of their lives there. Everyone has their own room, and there's also some shared common spaces. And again, it's meant to look and feel a bit more like a home or a community setting rather than a hospital. And it's meant to be also very kind of accommodating and supportive to family, friends, and other important people in that dying person's life, to be able to come visit them. And then lastly, as I mentioned, people may want to die in their homes, and I think I've had the great privilege of being able to kind of step into people's lives at this really important time and see what home means to them and looks like for them. I'm gonna kind of briefly share an anonymized anecdote here that I had. I've just seen patients who have had their end of life at home in all kinds of different settings, and one that kind of stands out to me of a patient who was considering, do I stay home or do I not? Do I go somewhere else? Do I go to hospice? Was I've seen a patient who ended up dying on their family's farm that had been in their farm for generations, and there's animals running around inside and outside, and there's kids running around inside and outside, and I think you probably can't quite recreate that anywhere else, and that's powerful, right? And so I'm so grateful that we have something like the Near North Palliative Care Network in our community to help allow that for people to stay at home till the end of their lives. I also wanted to mention, when I quoted that, 50% of people die in their homes, and another kind of statistic I'll give is that about a third of patients at the end of their lives receive palliative home care and a physician visit in their last month of life. So that's not everybody, and we can probably do better numbers wise. But the other thing to remember is that these resources, unfortunately, are not distributed equitably. And so people who live in lower income level neighborhoods, and people who live in neighborhoods with a higher proportion of immigrants to Canada tend to have less access to palliative care at the end of their lives, and tend to have less possibility of passing away in their homes. And so I think this is where something like a volunteer network can come in to kind of level the playing field, if you will, for someone who maybe doesn't have the financial resources to hire private support, or maybe doesn't have the robust family support to help support them at the end of their time, of something where a volunteer network can come in with a bit of an equity lens as well, which is so important. And then one of the last questions I was asked to answer today were, why do people choose palliative care? Again, I think I'll just reiterate that palliative care doesn't just mean death and dying, it means living along the way. And that's where we kind of come to how important the community is in its various members, including, of course, the Near North Palliative Care Network and the volunteering that they do. So I'm grateful to Monica and her team, and for everyone who's considering joining this or is already participating. I thank you so very much. I've seen that it makes a really big difference for the lives of the patients that I've seen, and they often develop a close relationship and a lot of gratitude to the volunteers that they see. Thank you very much for the opportunity to speak today, and thanks so much for putting this great kind of series together. Thanks, everyone.
Thank you, Dr. Moore. We really appreciate it. Next, we're going to welcome Dr. Jinnah. She works at the Near North Medical Clinic here in North Bay, and she's also the head of palliative care at the North Bay Regional Health Center. So welcome.
Thank you, Amber. Can you guys hear me?
Yes.
Okay, good. Rebecca, thank you, Rebecca, for asking me to be involved, and thank you to all the students, and thanks very much to Monica, as usual, doing great work with the Near North Palliative Care Network. Rebecca, I was asked to speak about the roles and responsibilities in palliative care in the community, as well as what people can do when they're a volunteer, a friend, a neighbor, healthcare provider out in the community. So I'm going to just sort of do broad strokes. I'll pick up on some of what Monica has said and a lot of what Dr. Moore has said as well, that we are a community that cares, and I think that's reflected. Right now, we're having difficulty because of shortage in terms of staffing, but the people who are out there are doing the best that they can. So in terms of roles, I would like all of you to think about the center of a wheel with the patient or the individual being a person rather than just a patient or a client. I know that some of you have to call them clients. So this is a person who needs help, and we as a palliative community support team with all our members are sort of a provisionary and protective circle around that person. And we provide for them what we can in terms of the care that's required in whatever form it may take, that's within our scope of practice. So that team is made up of many people, whether it's the individual's family, their neighbors, their friends, the PSWs who come into the home, the volunteers who come into the home, the nursing staff, the physicians, allied health, dietitians, everybody that comes in to do what they can. In terms of responsibilities, I think the most important responsibility for all of us is to provide an impeccable level of care per the WHO definition of palliative care. So whatever is in my scope of practice or your scope of practice, let's do the absolute best that we can. I would like you to remember that whether this person is the 10th visit of your day or the 4th visit of your day or the 1st visit of your day, you are possibly the first person that's come into the house or the hospital room or somewhere to see them. And so just make sure that you arrive knowing that this is an important visit for that person, no matter what service you are providing, whether you're providing a volunteer service or a PSW for hygiene care or a nurse to change a dressing. I was listening to a talk not too long ago, so I thought I might use some of the concepts that the person in this talk mentioned about our roles. So the most important role that all of us have is that of caring. So there's a few things that we can do that I think everybody can do, whether it's the physician, the nurse, the volunteer. And so I'll start off with number one, just smile, because smiling is great. You know, when you walk into a room or a home or a hospital or a hospice and you have a smile on your face, people automatically feel connected to you. It goes a long way to telling people that you are there because you want to be there, not because you have to be there. The second thing would be to be empathetic. So empathy is trying to put yourself in the position of the person. My dad was a family doctor, and the one thing that he taught me that always sticks is that when you're talking to somebody, imagine yourself in that chair, in that bed, on that stretcher, and somebody else is talking to you, and talk to them the same way that you would like to be spoken to. So empathy allows us to try to put ourselves, we can never completely do it, in a position where you can try to understand what the patient or the person is feeling and how they would like to be dealt with. The third thing would be communication. As a palliative care team, it doesn't matter what role we play, whether it's the volunteer, the PSW, the nurse, the physician, the dietitian, we are theoretically the experts, and what we say carries weight. So choose your words carefully and wisely, and pick the words that buoy a patient up, not words that weigh them down. Just be careful what you recommend. Even something as simple as a huh or oh dear can make a huge difference in a patient's thought and concept about what's going on with them. So importance of communication. To be present with them at the time. so that they don't feel that you're distracted and you're just doing something because you have to be there. The fourth thing would be to be positive and encouraging. So most of our patients who arrive to our team are people who are either early on in their disease dealing with a very difficult situation, or later on in their disease process where they know that life is going to end for them. So we need to be as encouraging as positive as possible in terms of them taking the time that they have in their day to be, and for us to be there to help them. And then finally, the one thing that's really important for everybody is practical help. So whether it is that you are able to help them with cleaning or shopping or photocopying or filling out insurance forms or managing their wounds or whatever it happens to be, whatever role we play, I think all of us can combine roles to make sure that the patient's journey when they get to our team is a positive journey, one that they can say, people who came to see me did the absolute best that they could. So hopefully we can all work towards that and continue to do the job that we're doing, the work that we're doing with the passion that Monica expressed. And as Dr. Moore mentioned, perhaps our statistics will get better as time goes on, as long as they've had somebody come into their home. It is difficult right now, but we do the best we can with the services that we have available. Thanks, everybody. Just think about what you can do.
Thank you, Dr. Jinnah. Now we're going to watch a short video that Dr. Jinnah had shared with us, and it's actually pretty interesting. So I'll let you watch this.
Together, we can help keep your community fed. Fight hunger, spark change with Walmart.
You are a bridge. It's true, or at least it's a good analogy. When you're healthy, when the bridge is sound, you can handle anything. Cars, trucks, trains, all the bumps of life, no problem. You are set. But if you're facing a serious health issue, something like kidney disease, lung disease, or cancer, the bridge starts to falter, cracks appear, and pretty soon it's hard to withstand all that traffic. Traffic that includes your own medical treatment. And that's where palliative care comes in. Palliative care is a specialized form of medical care, specifically designed for people with serious illnesses. Its main goal is to improve your quality of life by providing relief from the symptoms, pain, and stress that are an inevitable byproduct of both the disease and the medical intervention. In short, palliative care provides support for your bridge. And when a bridge is in trouble, there is nothing better. Now, palliative care, just like construction, is a team effort. It takes doctors, nurses, social workers, and other specialists, all working together with your physician to realize that extra layer, the layer that can make all the difference. It's a treatment method that makes sense at any stage of life and at any stage of an illness, because it's never too late to lessen the burden. So, next time someone you care about is facing a serious illness, remember this bridge analogy, and be sure to consider the enormous potential of palliative care.
All right. Again, once again, thank you, Dr. Jinnah, for speaking with us today. Do we have...
Are you or a loved one being treated for critical illness? Are tedious and...
Okay, so we're going to move along. Next, we have Mariah Holmes. She's staff at the Near North Palliative Center. She is the Nav-Care coordinator at the Near North Palliative Care Network. So welcome, Mariah.
Hi, thank you. So I guess I'll start by how I got here in this position. So my background comes from healthcare, but not with Monica, but I've been in long-term care for 10 years as a PSW and seen this opportunity to work directly with palliative care, and it caught my eye. So now I'm kind of set up in front in the field and behind the scenes helping people get into the field with recruiting volunteers and getting people set up to go into the community. I focused directly in our Nav-Care program, and that's to help people like volunteers support people with declining health to live as well and independently for as long as they can in their homes. And then we do have some that go into long-term care as well for companionship for when they don't have family that can come in as often. We help the clients with resources in our area for things that they don't know, like how to access things or how to find the transportation that they need to get from point A to point B and things like that. So we bring, if they can't get into the community, we bring the community to them. We provide companionship and emotional support for not just the client, but the caregivers as well. Sometimes our role is to help the client cope with the fact of that they are going to be losing their life. So sometimes it's emotional support, not so much for their condition, but for what they're leaving behind. Sometimes they feel guilty. Okay, what am I leaving behind? I can't cope with this. So we give them different coping strategies. And yeah, so I've been trying to recruit volunteers right now. We go through their training and bring them into the community, and we ask them, okay, are you more comfortable working in long-term care, or are you wanting to work with clients in their homes? And then we guide them to basically where they want to be and help them through that and help clients find the proper connections that they need with the different, if they want somebody that's there just for, the friendship, or somebody that can't be alone. And so we give them different volunteers based on their needs as well. So my job is to help match them up to the correct match, basically.
Perfect. Thank you so much, Mariah. Now we have Ewan. If I mispronounced it, I do apologize. They are an outreach and educator coordinator at the Near North Palliative Care Network as well. And he's going to speak about the volunteer experience that he has provided. So welcome.
Good morning, good afternoon, sorry, thank you. So yeah, my experience as a volunteer, I'm experiencing something that a lot more of our volunteers are starting to mention. Is I've had a client that for the last year and 8 months is a palliative care support client. So my experience there is most of the time, is just spending time with him, where he is able to discuss some of the things that he doesn't discuss with his family. Just really being present for the experience that he's going through, sharing, allowing him the opportunity to share, as he reflects back on his experiences through life, what his diagnosis means to him, the journey he's going through. Being that we've been together for the last year and 8 months, it definitely has developed into a friendship as things have gone along. Which, it gives you a different uniqueness to the experience of being a volunteer in this capacity. But it's, as I mentioned to everyone, the experience of volunteering with this organization especially is it becomes very selfish in a way that I haven't experienced in other volunteering that I've done in the past. You learn so much from the individuals you're working with and that you're around, the experiences that they share with you. It's a reminder for you every day to live your life in the present, be a part of what is going on, not just in your experience there, but it just really helps you to ground yourself because you're aware of, the impending situation someone else is dealing with. And in my experience, like I said, I mentioned, it's been a year and 8 months. So the journey, as that's progressed has really changed the way I look at and see things in my experience of my life, and how I look at my day to day, and really, it sets you back as to what's really important. So it's one of those things, like I said, I say to everybody, you do really feel selfish coming out of a lot of this because you know, you do gain so much from your client. You know, it's the experience is so rewarding that you look forward to it every time. You know, they do become your friend, and you know, it's something where you want to be with them each time, to continue to share in this experience and just what they're, you know, what they're going through. As I mentioned, it's so different than any other volunteering experience I've ever done, working with youth and you know, working with older clients with developmental disabilities. This is just, it really does change your perspective and your outlook on things and how you see it. So it's something that I love doing. I think anybody that, as Monica has mentioned, you know, given the opportunity to go and do it, it soaks into your blood and it resonates with you, and it's something that you want to continue doing forever. Thank you.
All right, thank you very much. We really appreciate it. So I think this kind of concludes everything. Do we have any questions for us? All right. So like it was said at the beginning of the presentation, we do have a copy of this PowerPoint with kind of more detailed information. If anybody was willing or would want a copy, just send Monica a message or get in touch with her and she will gladly send that over to you. So again, this concludes our presentation. We really appreciate everybody joining us today. We want to thank everybody, especially Monica at the Near North Palliative Care Network, for allowing us to do this presentation and letting us be part of her weekly meetings and everything. The email has been put there for everybody if anybody does want the PowerPoint. So again, we really appreciate everything. We have learned so much going through this and experiencing and kind of getting firsthand a little bit about the community and how Palliative Care Network is run and the volunteer experience. So again, we really appreciate everything. So if there's any questions, feel free to ask. Otherwise, thank you for participating and joining us on our lunch and Zoom meeting today. We all hope that you enjoyed this presentation. Thank you.
And before we go, I would like to give a big hand to the students of the School of Nursing that organized this and several other events to us. I am so proud of you all. I feel so humbled for your help to Near North Palliative Care, extraordinary contribution of the School of Nursing students, from Professor Carrie Maguire-Trahan to Near North Palliative Care Network, and for your time, each of you who are watching today. Part of you, I know that you are already part of our gang, but if you are considering volunteering, believe me, come and have just a little taste. It's difficult that we do not come back after we have a taste what it is to help people in the most important moment of their lives. Thank you so very much. And just looking if there was any other message in the bar. Thank you for all your thank yous to the group. And I hope to see you soon here in person. Thank you very much.
Thanks, everyone.
Gary, thank you. Gary, would you want to close with your last comments?
Yes, absolutely. Of course, our gratitude to our guest speakers today. I know both of you, Dr. Moore and Dr. Jinnah, have busy schedules. So thank you for taking the time out to help us. My students, I am so proud of you. This is, we only had, I think, one teeny weeny little technical issue, which was quickly fixed. I think technology is sometimes our biggest enemy, but we did very well. And I'm certainly hoping, Monica, we were able to rustle up some new volunteers for you. It is such an amazing organization. Been working with Monica now for several years, and I can't say enough good things. So thank you so much. So I would like to meet my students back in our classroom so I can give you all a standing ovation. And everyone enjoy the rest of your afternoon. Thank you.